Hey guys, this is Alyssa, and this is my response to P2 Discussion 5. After reading the scenario, question 1, what other information about the mechanism of injury should the paramedics have tried to obtain from the site manager patient? They should have asked these following questions. From how high up did he fall? What type of surface did he land on? Did he hit anything on the way down? What part of his body did he land on? Did he lose consciousness? Was he wearing any safety equipment? Did anyone witness a medical emergency like a seizure right before his fall? Number 2, what type of traumatic injury does the patient have? Blunt or penetrating? There is no indication of an object penetrating the body, although we should expose the patient in this scenario and check their back and their whole body to ensure that he didn't land on anything that could have penetrated him. Especially if he is intoxicated, he may not feel pain as well and may not know that he landed on something. But in this particular scenario, based off the information we have, the patient has a hematoma on his forehead and he fell from a height. This is consistent with a blunt traumatic injury. Number 3, do you believe the patient should be transported? Why? Yes, the patient should be transported. Since the patient fell and has a hematoma on his forehead, he needs to be assessed at the hospital to make sure he doesn't have internal bleeding or other injuries that we can't see. Also, since his breath smells like alcohol, his blood may be thin and not able to clot as well, which could exacerbate the possible internal bleeding. Alcohol intoxication could also dull his senses, and he may not feel as much pain as a sober person would, which could hide more serious injuries. Number 4, when should stabilization occur? In the field or en route to the hospital? Why? Stabilization should occur on scene since the patient is in stable condition. He's walking and talking, so he has a patent airway and most likely good blood pressure. He's speaking in full sentences, so his ventilations are adequate and unlabored. He's aware of what happened and has a GCS of 15. These are all indications that he is stable, so it would be best to stabilize him on scene and try to protect him from sustaining more injuries or exacerbating existing injuries. If at any point he seemed to be declining to an unstable condition, then we would want to immediately transport and stabilize en route. Regardless, we want to make our time on scene as short as possible and get him to the hospital as soon as possible because he could deteriorate quickly if he has a traumatic brain injury. Number 5, what are at least 3 injuries or medical conditions that may have led to the fall or been incurred as a result of it? Number 1, being intoxicated could have impaired his motor function and coordination, leading to the fall. Number 2, he could have suffered a brain or head injury based off of the hematoma on his forehead. Examples would be a concussion, skull fracture, intracranial hemorrhage, or an epidermal, subarachnoid, or subdermal hematoma. He could have also suffered a spinal cord injury or a bone fracture from the fall.